grouping. Start that now. Let me share my screen. Can you all see my screen? Yes, okay, wonderful. First of all, I want to say thank you to all of you. This is quite a big group. I wasn't expecting this many folks to join us. And the fact that you all took time out of your Thursday evening on a very busy week to join us last minute is very impressive. And I just appreciate you all so much. We had a few meetings with the breastfeeding family-friendly communities groups over the last few days, and the formula shortage just kept coming up. And there's been so much information that's been flowing through emails and different position statements and things going out that it's just a little mind-boggling to kind of keep it organized and put all the information together. So we thought it would be a good opportunity to get some nutrition professionals and some lactation professionals and some providers and some WIC folks together into one space so that we can kind of bring a bunch of the information to the table and share. And then also create an open forum for everyone to talk about what have you been hearing from your patients, from your friends, from your family, from your community, and what are some additional ways or avenues that we can try to help get some information out there and address the issue to help support our families over the next few weeks while this formula shortage continues. So we'll start off, let me see, I don't know if I can, there we go.
So I'm not seeing your screen right now, Alicia.
Are you not?
I lost it. I don't know if anybody else did.
Yeah, I think you need to share again, Alicia.
Do that. I might have to change this off of the presentation view. I'll share it. See it now?
Yes,
There you go.
it's up there.
It won't let me share if it's in presentation view, I guess. Okay, so basics, and this I think has been shared quite a few times. In February of this year, an Abbott formula plant in Sturgis, Michigan was shut down after bacteria was found in several of their products. It came to light after the fact that there'd been some whistleblower complaints about safety at that plant dating back to October of last year. So that plant was responsible for producing 20 of Abbott's specialized infant formulas. And the repercussions of that plant shutting down are what we're experiencing right now. This plant, well, the formula industry in general in the United States, I've learned a lot over the last few weeks. 98% of the formula that's consumed in the United States is produced domestically. And 50% of the formula consumed here is consumed by infants that are on the WIC program, which is myself, and there's several other folks on here that are representing WIC. The Sturgis plant is set to reopen in the next 1 to 2 weeks, but it will take an additional 6 to 8 weeks on top of that before the formula that they're able to produce will hit the retail shelves. So with that being said, the formula shortage is anticipated to continue for at least the next 8 to 10 weeks. There are some formulas that are readily available in stores in our coverage area, and then there are some that people are searching high and low to find and are really, really struggling. So we'll talk a little bit about all of that. So just to briefly to introduce myself, because I did not do that at the beginning. My name is Alicia Bailey. I'm a lactation consultant, and I'm also the WIC and breastfeeding program manager for Piedmont Health Services, which is in Central North Carolina. We provide WIC services to Orange and Chatham counties. And Piedmont Health Services is an FQHC that has community health centers across 4 counties in Central North Carolina. So in talking to our patients and our community in Central North Carolina, some of the things that we are hearing are that our patients are having widespread challenges finding some of the standard Similac and Enfamil formulas, as well as almost all of the specialized infant formulas. Some folks have told us that they've been traveling hundreds of miles to other states trying to find formula products. They are trying to order from foreign markets and have it imported into the United States. I don't know if any of you are on different parenting Facebook groups and things, but there's been lots of information flowing about how to try to order from Amazon Canada and import it into the United States. A lot of folks are relying on the secondhand market. They're reaching out on social media to strangers in other parts of the country and trying to buy directly from other people and have it mailed to them. And then there's a lot of folks that are relying on friends and families that live in other parts of the state or other parts of the country to go to different stores, try to purchase products, and then ship them to where they are. We are hearing some folks say that they're diluting formula more than what the instructions on the package say in order to stretch out the formula that they have. And then those of you who are on social media probably cannot avoid having seen the recipes for homemade formula that have been on there. And also, lastly, there's quite a few really well-intended pop-up aid groups around that are trying to buy formula when they see it and then be available to distribute the formula products out to families in need. The problem with that being it's removing formula from the shelves. So the folks who are trying to seek formula for their own families are not able to find it at stores. And if they don't know about the aid groups that are offering formula to families in need, then they don't know who to reach out to. And if the aid groups don't know about the families, there's no connection between the two. So it's contributing to the shortage in the stores. And then of course, just like the toilet paper situation, we do have some panic buying that's happening. I sent our team out on a little field trip today to take a look at some of the stores in our area. And we'll share some of the pictures of the shelves in our area in a moment. But one of the things that we were noticing were signs that indicate that folks can only buy 2, 3, or 4 cans of formula at a time. One of the concerns from a WIC perspective was that those restrictions were being put on WIC families, but not on others. But it does seem like, based on the signage that I at least saw in stores that I visited today, that the signage is just kind of speaking to formula purchasing in general. So the last thing that we have been seeing is some inappropriate or really early introduction of alternative milk products and any white fluid. So sometimes people who just don't fully understand what's in formula and why the ingredient components of it are important think that anything else that looks like milk or formula must be just as good. So just making sure that we are very carefully educating the folks that we're supporting so that they understand the risks of those practices and trying to support how to find them a healthier and safer alternative. Some of the things that we want to make sure we're asking to our patients and the folks that we're supporting, do you have enough formula at home? Are you having trouble finding it in the store? How are you mixing the formula? I know there are some families in the area that we support who wouldn't necessarily share that information unless they're asked. So if we don't ask, we don't necessarily know that they're struggling to find formula. We don't necessarily know that they're adding extra water to stretch it out. We don't necessarily know that they didn't sleep last night because they drove 500 miles round trip to some place in Kentucky to buy formula. So these are things we just want to make sure we're asking. Let's see, blank slide in there by accident, apologies. Oh gosh. Okay, so I am going to bring Dr. Emily Hannon up for a moment. She's right up here. She is a pediatrician at Western Wake Pediatrics, and she's also an IBCLC and is the breastfeeding co-coordinator for American Academy of Pediatrics in North Carolina. So she's going to speak a little bit about the American Academy of Pediatrics policies and recommendations, and some infant feeding guidelines for us during this formula crisis.
Yeah, thanks, Alicia. It's so good to see everybody here tonight. So I just wanted to go over some of what the AAP has been doing recently, along with some of the things that the North Carolina Department of Health and Human Services, particularly the Division of Child and Family Wellbeing, has been pushing out to providers and families in the past week. So, some of the do's and don'ts for providers specifically are, as Alicia was saying earlier, review the safe formula preparation with parents. Take every opportunity you can to make sure that they're feeding their infant properly and in a safe way, and they're mixing that powdered formula correctly. Do all that we can, as I know this group all does, to continue encouraging breastfeeding. If the family is currently breastfeeding, clearly this won't work for a family who is not breastfeeding. But if you have a family that's doing a combination of breast milk and formula, really try and encourage and support as much as we can that breastfeeding. Think about whether relactation is an option for the family in front of you. That requires a little more effort. We're going to talk about that in a couple slides, but you do have some resources around you that you could reach out to if your family's interested in relactation. And then there's been some talk recently about how to safely introduce solid foods at 4 to 6 months. So just to give you a little bit of a background, 10 plus years ago, the American Academy of Pediatrics recommended waiting until after 6 months to introduce solid foods. But then there was a large study published called the LEAP study that had to do with food allergies specifically. And based on that study, we now actually recommend introducing complementary foods closer to 4 months old. So this is not outside of the normal range of what we have been recommending for the past number of years. So introducing those solid foods, particularly for these infants, solid foods that are high in protein and high in iron. So like mashed egg yolks, mashed avocado, some lentils or legumes, and even some meats that are steamed and are very soft. So those are things that you could try for infant that's over 4 months old and able to hold their head up really well in the infant seat. And then has been some just this week interim guidance on feeding cow's milks to infants 6 to 12 months old. We do not typically recommend this as pediatricians and family medicine docs. We really like to wait till 12 months old because the cow's milk is really deficient in iron. But in a situation like we're in right now, where there are no other options, if your family is in dire straits, cow's milk, whole cow's milk is better than nothing. So we would recommend paying special attention to making sure that you're getting iron into that kid as well through the introduction of other solid foods. And then providing guidance about transitioning from one formula to another. And we're going to spend the next couple slides talking about that. Specifically, though, I want to mention it says cow's milk here, don't offer cow's milk, but we've just talked about the new interim guidance just this week from the AAP that cow's milk is acceptable down to 6 months old if in a limited situation in dire straits. But really, we should not be introducing plant milk-based alternatives because they don't have the nutrients that an infant under 12-month-old needs. We do not recommend homemade formula, and we, as Alicia already said, don't recommend diluting the formula. So we can go to the next slide. So the Division of Child and Family Wellbeing through NCDHHS has created this formula equivalency table that is currently linked at the end of this presentation, so you can find this link yourself. I think this is very useful. I have printed this and had my nurses in my office hang on to this when families call and say, I can't find my blank brand of formula. They can look at this chart and see what the other similarities are. And honestly, for most kids, you can kind of jump around this chart. In dire straits, this is what we do. We always recommend sticking with the same type of formula, but in a situation like this, it is okay to jump around if you can't find one formula. And I would pay special attention to that store brand list, all made by Perrigo. These have typically not been as affected in this formula crisis as the name brand. So you might want to really pay attention to that. We can go on to the next slide. So this continuation of the list just goes into some allergies and then prematurity. And you'll see as we get farther down in the list for the premature infants and the special dietary needs, there is a decreasing number of choices. So those are the kids that we really worry about who just do not have another option in this formula crisis. And the next slide has the end of that. And these are the very specialized formulas. honestly, all that were produced in that Abbott plant in Michigan that is still closed. Next slide. So I think I'm going to pass it off to someone else. Yeah.
Thank you. I'm going to take a quick pause and break from the slides here. We have Bernadette Green with us today. She is here representing Breastfeeding Family Friendly Communities Durham, but also as a caretaker for an infant. And I thought it would be helpful for us as healthcare providers to hear from the perspective of somebody who's caring for an infant on formula, what it feels like to be trying to find formula in the stores right now. So Bernadette, if you want to speak with us for a few minutes, we would really appreciate that.
Yes, as Alicia said, what it feels like, it's aggravating, it's scary, and it's really just worrisome to me because my grandson is 9 months and I have to get permission from his parents to try different milk. And, you know, when you have a parent living in Florida and a parent living in Atlanta and they can't find any milk, it's horrible because you can't find no milk here. I have went to Compadres, Compare Food on University. They have nothing. They had none of the milks that he drank. And when I tried to order from Walmart, everything is out of stock. Even the name brands and the off brands are out of stock. So I was running around with Love trying to figure out how I'm gonna feed my grandchild. What am I gonna feed my grandchild because he's on his last can of milk? And to say, okay, get soy milk. I don't want to give my grandchild soy milk. I don't know how that's going to react with his stomach. How is it going to, pertain to his diet? I'm looking for white. So I'm just right now at all odds because I don't want to give him anything that's going to mess up his diet. I don't want to give him anything that's going to have his stomach being turned upside down when I don't know really what's going on. And to find out that we just now finding out that there's no milk, it's a lot crazy. You can't even get it from Amazon. The milk that I was looking for, you couldn't even get it from Amazon. So I am that grandmother that's going around saying, how can I feed my grandchild? What can I do? Like you just confirmated that the milk from 6 months, from 6 months to a year can do the whole milk, because I was thinking goat milk. So I'm glad that was clarified, but it's really bad out here, and someone needs to start letting these parents out here know that there may not be no milk no time soon.
Thank you, Bernadette. We really appreciate the perspective. And we will talk a little bit about our prenatal population and informed decision making in a minute. So I'll speak for a few minutes about the WIC process. So the North Carolina WIC program has made a few interim changes during this the formula shortage to help both medical providers and families gain access to formula without too many hoops to jump through. So we will be sharing, I don't know if you as the medical providers are aware that there's a fillable PDF that's available online. That's the WIC formula prescription form. So you can fill out the fillable PDF and then print and sign and send that into the WIC office. So it saves a little bit of time if you're writing a script for a WIC family when you're in clinic. You temporarily have the ability to write multiple formula products on the formula product line. So normally you would only be allowed to indicate one particular product, let's say Nutramigen and Flora LGG, which is a hypoallergenic formula. Currently, during this formula shortage, you have the ability to write in multiple equivalent formula products. So you could write several hypoallergenic formula products in that formula prescription line so that the WIC office has the ability to work with the family to put on their food package the product that the family reports being able to access in the store. So that's something very important to note. When the formula shortage is over, we'll have to go back to only indicating one individual formula product on the WIC prescription form. But for now, you can write in multiple, so that's helpful.
Could I ask a question on that point?
Yes, please do.
Thank you so much for that. How does those substitutions overlap with the table that we just saw? Are any of those options on the table options through WIC vouchers, or is it a subset of those?
Yes, so let me show you. So if you look here at the first slide, so these are what the blue section up here, as well as the white section down at the bottom are all, so let me go back a second. North Carolina has contract with Gerber for our infant formula. So our standard contract formulas are Gerber Good Start Gentle, Gerber Soothe, and Gerber Soy. So essentially, all of the other products on this particular screen are not allowable through the WIC program because there is a WIC contract formula equivalent. And these formulas, so this Gerber line right here, oops, I just moved it, apologies. The Gerber line right here, in general, those products are available in stores for the most part. The formula products on this grid right here and this final one, these are the ones that you would be able to write multiple products for across the formula list. So let's say you have an infant here that's on Nutramigen, you could write in Gerber Extensive HA as well as Similac Alimentum on that product line. And then the WIC agency would be able to work with the family to figure out which individual food product we would be able to put on their package. They can't have multiple products listed on their food package, and so that they have the option to purchase what they can find in the store. We only have the ability to put one individual formula product on their food package. So if, let's say, we put Nutramigen on their food package and they get to the store and there is no Nutramigen on the shelves, but they can find Gerber Extensive HA, they would have to call us at the WIC office so that we can manually change their food package in our system and then reset or kind of reissue their food benefits onto their card, which is an instant real-time thing. It doesn't require any sort of voiding or returning of vouchers like we used to have when we had paper checks, which this situation when we had WIC paper checks would have been a whole different animal. We have the ability to make that food package adjustment in our offices, and that instantly makes the adjustment on their WIC card that they have from the store so that we can make those changes while they're still in the store. But we don't have the ability to do that if multiple products are not listed on the food prescription form that's sent over by the provider, and they don't have the ability to make those formula changes within the store. So let's say they see Gerber Extensive HA, but they're on their card, it says Nutramigen. The store is not going to allow them to make that formula exchange without it being updated on their food package and their card. Does that make sense?
That is helpful. Thank you. So in this case, would you recommend that somebody just lists as many alternatives as possible in the prescription?
Yes. And I'll get into a little bit more details about the prescription process for you. Okay, so for any formula products that are WIC approved that are not considered our standard formula products, which again are Gerber Good Start Gentle, Gerber Soothe, and Gerber Soy, we have the ability to place an order for those products with the state WIC office.
What, baby?
Prior to the formula shortage, there were certain formula products that were listed as state order items, and then other products that we would put on the participant's card for them to purchase in the store. At this point, because of the formula shortage, we have the ability to place an order with the state for any formula product that is not our standard contract formulas. Something to know about that is that there's a 7 to 10 day lag time between when the local WIC agency places the order for a formula product and when we receive it back in the clinic to distribute out to the family. So it's not an immediate fix for families that are having trouble finding a formula product in the store. And jumping ahead to something I have on our slide forward a little bit, WIC does not keep an inventory of formula products at our local agencies. That's kind of a misconception, comes up often, is that formula is in stock at the WIC office. So if somebody comes in, we aren't able to have them walk back out of the office with a can of formula in hand. Sorry, my son's asking for a drink. So another important thing to note about formula orders placed from the state is that we again have a contract with Gerber. Gerber has the contract in 6 states in the United States. The states that have the contract with Gerber take priority over products being shipped to retailers in other states that don't have the Gerber contract. So North Carolina is one of the states who has priority over inventory being shipped to our state. Orders placed by the state WIC office directly to the manufacturer on behalf of our participants take priority over orders going to retail sites as well. So if a formula product is actively being manufactured, but is not available in local stores, and we have a WIC participant that reports that they're really struggling to find a product in the store, if you as a medical provider or as somebody else that's supporting them, you can help the family get connected with the local WIC agency. We can place an order on their behalf with the state agency for that formula product, indicating that they're having a hardship finding those products in local retail stores near where they live. And the state office will then request that formula product, a 1 month supply, whatever they're prescribed through their WIC food prescription, which will come directly from the manufacturer back to the local agency. The local agency then contacts the family and we make arrangements to either deliver or have them pick up that formula product. And they would pick up a 1 month supply of that formula product. Something important to note, if a manufacturer lists a formula product as out of stock, any WIC state order requests may not be filled if the product is out of stock at the manufacturers, or they may not send us the full amount that we're ordering. So let's say we order 12 cans of Nutramigen for a particular family, they may only send us 8 or 9. Because of the high volume of orders that are now going through the state WIC office in North Carolina, the orders for through the state office have gone up 525% since the formula shortage began. The communication back and forth between the state office and the manufacturers and the state office and all of the above and the local agency is not happening really at an adequate speed. So the local agency might not know immediately that an order is not going to be filled. The state office might not know that either. And we also might not know at the local agency that we're not going to receive the full amount that we requested. So I wanted to make sure all of that was clear. And Ashley, I'm calling on you because I didn't get the chance to look at the email that you just sent me before this meeting started. Were there any additional updates that were in that email?
No, there weren't.
Okay. Something else that has caused a bit of confusion, WIC on a national level has asked for several flexibilities to make it easier for WIC recipients to make formula purchases in the stores. North Carolina at the moment only has the authority to grant one of the 3 flexibilities. That flexibility being the listing of multiple formula products on the prescription form. The ones that we do not have the ability to utilize are families in the stores being able to purchase different product sizes than what is on their food package. So let's say Gerber Good Start Gentle, if they get the powdered formula on their card, it's the 12.7 ounce powdered round cans. if the round cans are not available in the store, they don't have the ability to purchase the larger tub size at the store. In other states, that is a flexibility that is available, but in North Carolina, it is not. They also cannot change brands at the store. So let's say, we have a contract with Gerber. If they have Gerber Good Start Gentle on their food package, that is not available in the store, but they see that Enfamil is. They don't have the ability to use their WIC card that indicates Gerber to purchase a Similac equivalent product. In some states, that is an available flexibility, but in North Carolina, it is not. The good news related to that one is that it seems that the Gerber products are what is most available on the shelves in the retail stores. So that one's a little bit less applicable in this situation. A question that came up related to WIC and formula products, kind of related to what I was just saying, is that we cannot aid families in obtaining non-WIC contract standard formulas. So again, like we just said, they can't switch brands at the store, but we also can't prescribe or add onto their food package different standard brands. So if there is, this is just if you're going back to the grid that Dr. Hannon put together that we shared a little bit earlier, the Gerber products in the center are our standard contract formulas. These other formulas on either side are other brands equivalents to our contract formulas. We don't have the ability to put those other equivalent formula products on their WIC food package. So there's not a way for WIC to support them purchasing non-Gerber standard products with their WIC card. And I've already spoken about the inventory piece. Okay, so I'm going to pass it off to Natalie Ostrowski, who is one of our registered dietitians and lactation consultants at Piedmont. And she's going to speak with you all for just a moment about relactation.
Hi, everyone. Thanks, Alicia. So I wanted to just speak on this for a moment. I think this is something that is relevant in this conversation. I think we've all seen, maybe in news articles on Twitter, comments about families like, why can't you just breastfeed, for example? And I think a lot of us know that it's a lot more complicated than that. But for some families, this is an option. Relactation is referring to the physiological process of lactating after lactation has stopped for some period of time. And it is possible to restart that process. The name of the game in relactation is breast stimulation. So if you're a provider and you're talking to a family about this as an option, some of the things that should start, that you can start supporting the family to be doing, is encouraging things like skin to skin and frequent sucking at the breast. If there is some issue with the infant or child sucking at the breast, other things to support stimulation, like using a breast pump, manual or electric breast pump. Hand expression is another way to get stimulation, or at breast supplementers, using either breast milk or formula. And basically that's supplementing the infant with something to eat at the breast to kind of help stimulate their sucking at the breast. Additionally, things like trying to stop use of other bottles and pacifiers, and that's mostly just to encourage any of that sucking to be happening at the breast and helping with breast stimulation. And then optionally, there are lots of herbs and medications, herbal galactagogues, things that can help to support milk supply. It is really helpful to discuss with a lactation-focused healthcare professional about someone's specific medical history and any contraindications to any medications or herbs. I do think it's important to mention that this process can vary quite a bit depending on the person, depending on the family. It can take days to weeks to see these changes happen and an increase in milk supply. I think from the healthcare provider perspective, it's really important to help, if you're supporting a family through this process, to monitor things like infant weight, output, hydration and nutrition status of the infant. And ultimately, I think a good question to be asking is, why did breastfeeding stop initially? Or why did the lactation process stop initially? Were there underlying hormonal health issues, possibly any supply issues, socio-environmental challenges? I think another, things that can really impact success in relactation and kind of increasing milk supply, whether that's to supplement an infant's diet or completely take the place of formula, for a while or temporarily, is, does this parent have the ability to support a schedule where they're kind of getting that regular stimulation? And then finally, do they have lactation support? Do they have access to equipment? So it's possible, but it definitely takes support on many different levels. And I think it's important that we are, clear about that process, that it's like breasts aren't faucets so they can turn on and off. It kind of takes some time and it's a gradual process. So it's definitely possible, very dependent on the situation, case by case basis. And I think if a family is interested in this, getting someone who's in lactation to talk with them and talk about that process is important.
Thanks, Natalie. We have had a few patients in our clinics anyway that are no longer breastfeeding their own infants, but are interested in thinking about relactation in order to help friends or family. So that's something else. You might not get those requests from parents who are trying to feed their own babies, but they're worried about their community and are trying to find ways to help. So offering contact to the breastfeeding support that are in the various areas that we all cover is great. And at the end of this slide set, there are some links to like the NCBC directory for how you can connect to lactation support in the community. You can always reach out to the WIC agencies. Even if a family is not a WIC recipient, we have a wealth of knowledge as to what other lactation support there is in our community. So you are welcome to contact any of us from WIC that are here on this call today, and we would be happy to help get your patients and your families connected to lactation support in the area where they live. Okay, Emily is going to talk with us a little bit more about donor milk and the milk bank that we have here in North Carolina.
Yeah, so thanks a lot. So just wanted to talk a little bit about, many of you are familiar with the Himbana Milk Bank that's here in North Carolina at Wake Med Mother's Milk Bank at Wake Med Cary. It is our state's and regions actually milk bank. And so milk that is processed through the milk bank at Wake Med is tested, and the donors are tested, and the milk is tested, and it's pasteurized. And so it is safe for consumption. That is not true about informal milk sharing. However, we know that in situations like this, like I mentioned before, when we were talking about cow's milk, we need to give people the next safest alternative. So we can help families make informed choices about the risks and benefits of informal breast milk sharing. When I'm talking to families, I recommend that they, if they're going to take breast milk from someone else, that it be someone that they know very well, a close contact who they really trust, because that person will probably not have been screened for all the many diseases that the Himbana milk banks screen for. And we always strongly discourage the use of any milk from anonymous donors or paying for breast milk on the internet. There are a couple of resources here that you might be interested in. If you're if you're helping a family that has a wealth of breast milk that they'd like to share, I would strongly recommend checking out the donors page on the Wake Med Mother's Milk Bank. Although I will say that process of getting approved as a donor is a little bit of a lengthy one. And then I think Alicia, was somebody else going to talk about more about the informal? Charlotte, I think.
Yeah, absolutely. Sorry, I'm responding to Kate, but I will get back to you in just a minute. Yeah, so more on informal milk sharing, as Dr. Hannon mentioned. It isn't as secured safe as procuring from the milk bank. but certainly it is an affordable option for parents. So there are several informal milk sharing groups through Facebook and on the web that are really based on kind of an honor system. So the idea being these moms are feeding their own babies their milk. They have an oversupply and they want to share. These groups have rules that you cannot sell your milk, with the thought being, you know, sometimes if monetary payment is involved, there could be some not ill will, but there could be some tampering with the milk. So we always encourage people who are searching out through informal milk shares that they're not paying someone for the milk. However, replacing bags, replacing pump parts, or if, you know, they had a long-term milk donor and they're really wanting to say thank you, certainly like a gift card or something like that. I personally have experience receiving donor milk, and, you know, I strongly encourage people to get to know their donors first if it is not someone they know, but typically it is a relatively safe route. There's also a way to make informal milk received more safe. And that's by following the Holder pasteurization method. It's exactly similar to what they do at the milk bank. You can do it in your own home. I also did this. So you will batch your milk and you can heat it to 145 degrees for 30 minutes. You hold it at that temperature and it will inactivate bacteria and viruses, including HIV and Ebola. However, hepatitis B and Bacillus cereus are the two nasty viruses and bacteria that are still potential. So you want to be really sure with the informal milk that the donor is negative for those types of things. In general, it is a very safe way. There has been a lot more foot traffic to these groups of late. And so it's hit or miss whether someone will actually get milk, but it's definitely worth a shot.
Thanks, Charlotte. Okay. And just a little plug, I don't know how many of you see prenatal patients in your clinics or support families during pregnancy, but I think this is a critical opportunity for us as lactation professionals and just as healthcare providers to make sure that we are talking to our prenatal patients about breastfeeding. There are a wealth of opportunities online for prenatal breastfeeding education. The Ready Set Baby courses through CGBI are free and they're offered in both English and Spanish weekly. There's a link on the slide that we'll be sending out. So you don't have to pre-register ahead of time. Families that are interested in joining the prenatal breastfeeding education classes can just click on the link and join the class. The WIC office also does prenatal breastfeeding education. I can speak for us at Piedmont Health. We do one-on-one prenatal breastfeeding education with our WIC recipients by phone and telehealth, and also in the medical clinics if they come to one of our sites for prenatal care. We can also do one-on-one in person in the WIC office, but currently because of the COVID pandemic, we're not required to have our WIC recipients come into the offices. We're doing a large majority of our WIC services by phone, so as to reduce barriers to access to the services for our families. So there's lots of opportunities for prenatal breastfeeding education to help promote breastfeeding. I think also it's really, really important for us to talk with our pregnant patients and our families that we're supporting about the formula shortage. I know a lot of the patients that I've seen lately who are pregnant with their first baby might not be aware of the formula shortage because they've not had to buy formula for one of their other children. Or if they don't have friends or families with infants, they might not be hearing about it. Not everybody watches the news. I know my husband doesn't because he thinks it's depressing. So if you don't pay attention to the news and you're not directly related to what's going on, you might have absolutely no idea about the formula shortage. And I had several patients that I saw in our Moncure clinic yesterday that did not know anything about the formula shortage. So it's really, really important for us to give our pregnant patients all the information that they need in order to make informed infant feeding decisions for themselves. So those two things come together: promoting breastfeeding, providing prenatal breastfeeding education, connecting them to lactation support, and educating them about the current formula shortage. Okay, and the next couple of slides, like I said, I sent my team out on a field trip today to look at different retail spaces in some of the areas that we cover. So the next couple of slides are just to share with you what the formula shelves look like as of today in the spaces that we are supporting. So apologies if some of you are coming from other areas. My folks are kind of in Chatham and Orange County. So this is the Walmart in Hillsborough. So if you see, there's some store brand formula in there, and it looks like I don't know what brand that is in the center. I think that's Gerber. So that's a lot of the WIC contract formula there in the center. This is the Food Line in Hillsborough, so a bit less, and you can see quite a few of these little kiosky things are empty. And I don't know how much is behind the can that's in the front. This right here is the Harris Teeter in Carborough. So you can see that there's, it's a very, very small section for formula in that particular store. This is the Walmart in Siler City, which our Chatham County families, a large percentage of our Chatham County WIC families shop at this particular Walmart. So again, quite a bit of the WIC contract formula, the Gerber formulas, but you're not seeing a whole lot of the other brands. And I don't see very much of any of the specialized formulas. This is what I saw in Target today at the one that I went to. There was 6 cans of each of those formulas. And I am not our vendor coordinator for WIC, but I think that might be exactly what the minimum required inventory stock is for our WIC products. The signs up here say informing shoppers about the formula shortage and directing them to the Target website to figure out where to purchase formula. But I think Bernadette could probably speak to trying to purchase online, that it's equally, if not more challenging, trying to purchase formula from online places. And then the other sign indicates that there's a 4-can maximum per shopper. This is the Food Line in Siler City. Again, oops, you're seeing some store brand formula, and the picture here on the right is just, it's pictures of all the formula cans. And I think Charlotte, where you went to this one, it's directing everybody to customer service to get formula. And then this is all that they have in their stock. And I think you mentioned that you talked with the store manager when you were there, right?
Yes. Yeah. And they're getting shipments about 3 times a week. But typically the Gerber is the most available and the most often shipped. The other brands are coming really sporadically.
And the stores don't have control over what they receive either. I think they place an order, but it's not a guarantee that what they ask for is what they receive. So I think even if we direct families to talk with customer service at their grocery store or their pharmacy about getting formula in, the store is going to frustratingly probably be able to tell them nothing more than we don't know, which when you're desperate for formula for your baby is not at all what you'd like to hear. This is the CVS in Siler City, and you can see there's a few cans of the Earth's Best organic infant formula, but that's just about it. This is the Compare Foods. Is that how you say it? I always think I'm saying it wrong.
Yeah, that's how you say it.
Okay, it looks like they have some of the Gerber formulas, but that's all. This is the Piggly Wiggly in Siler City, so they have a little bit more of a variety, although the bottom shelf is toddler formula and Pediasure, I think. And then this is the Target in Greensboro, so that's maddening. I think that's most of what we had to share with you. The last two slides here are some resources. So we'll be sending out the recording and the slide deck with all these links to all of these resources for all of you. I wanted to save some space and some time for everyone to kind of share your experiences. Are there other things that you're hearing from your patients and families you're supporting that we can talk about here, or are there other things that you think as a group of lactation medical and nutrition professionals that we should be addressing, or other spaces that we should be reaching into?
So Alicia, I'll just jump in. Gail just asked a question in the chat about the toddler formula, which you mentioned. So the AAP does not recommend toddler formula under age 1. They haven't really said whether they're going to make an exception like they did with cow's milk for under age 1. So I would really reserve toddler formula for the older infant, like 10 months plus, if that helps.
Thank you. If there are any other questions in the chat. There were a few questions about connecting families who get Medicaid with WIC lactation support if they are not WIC recipients. So I will say that because of the COVID pandemic, we have some physical presence waivers in place that allow us to do WIC enrollment by phone. They're not required to come into the WIC offices to initially enroll in WIC. We don't require that they bring in and show proof of ID, address, or income. We can do everything over the phone. So if you as a clinician or a supporter have a family who receives Medicaid or food stamps or Work First or TANF benefits, they all automatically qualify for WIC based on their participation in those other programs. So Ashley put a link to the WIC referral tool in the chat. You can go to that tool. There's, I think, 3, 4, maybe 5 quick sections of information that you can drop in there. It goes directly to the local agency email based on the zip code that you put in real time. So we get it immediately, and usually within 24 hours, the WIC office will reach out to the family. We can enroll them by phone and get them immediately connected to breastfeeding support from the local WIC agency. All WIC agencies are required to have breast pumps on hand. We all have peer counselors. We all have IBCLCs. So we can immediately jump in with peer counselor support and some IBCLC support and help them get set up with whatever it is that they need to meet their breastfeeding goals, to increase their supply, whatever is necessary. We do also carry SNS in some WIC agencies. So if you have a family who's interested in relactation or increasing their supply, then through breast stimulation, they can always feed either donor milk or formula through the SNS to help with nipple stimulation, to help with improve their milk supply or relactate. So that's another step in that process we can help with. Feel free to come off mute if you've got other questions or comments.
Alicia, did you when you sent out everyone to do their homework with them in the stores, was anyone sent to the derm store? Did you say compares?
I don't have any of my team that works out of Durham, so we didn't go into any of the Durham stores, unfortunately. I imagine they look a whole lot like the ones that we have in Orange and Chatham County. Although you're in a more urban area, so it's possible that it's worse where you are.
Yeah, and that's why I'm asking that question, because you have moms calling at night to different organizations like EBB or Mom Aid and Hearts and stuff that's calling them saying they need milk. So that's why I'm asking that question. What is Derm doing? I mean, cause I'm hearing Chatham, I'm hearing Orange, I'm hearing everybody else, but I'm not hearing Derm. And so I'm kind of, confused right now or concerned because I'm like, well, what is Durham doing? Because we have, like you said, we live in an urban area, so it looks bad. And I think I'm gonna have to do some homework too and just send out some take some pictures and send it to everyone of how the shelves look out here. Because if they're looking crazy where you're at, they got to be looking real bad over here.
And I will say, I don't think we have anybody from the Durham Health Department or Durham WIC on this call, but we do have connections. So we'd be happy to reach out to the Durham WIC office on the collective behalf and check in with them and see what their plan is. I do also know that the state WIC office just sent out an email earlier today to all the WIC directors of the local agencies in the state asking us to check in with our vendors and see what local inventory looks like. So if the Durham WIC office has not already been taking a stock of what their stores look like, they will be doing that in the next couple of days.
Okay. All right. That's what I wanted to know. Thank you.
Of course.
Alicia, I have a
Yeah.
question.
Go ahead, Ritza.
If a family is already receiving formula from WIC and they, because I have 2 moms yesterday who asked me, oh, I we need some more formula. They are doing both. They are breastfeeding and formula. And then they said, I think that I need some more formula. So I tell them to call to the WIC office to find that out about that policy. What is the next step with them? Because they just want to have more extra formula because of what is going on. Not because they are still having exactly. So if they are already getting that amount for the baby's or formula for the baby's age, so if they request an extra formula, can they get it?
If they're receiving the maximum formula food package from WIC, then we don't have the ability to give them extra formula. WIC being a supplemental nutrition program for a 4 or 5 month old baby, what WIC is able to offer is a little bit more than half of what they're likely to need. That might be where what Emily was talking about with the earlier introduction of solid foods might kind of help bridge the gap there. If the baby is on a specialized formula, like a prescription formula, and they receive Medicaid, we do have the ability to connect with Medicaid and see if they can get additional formula directly from Medicaid to complement what they receive from WIC. So that's something that you can ask that family to contact the WIC office, and we can work with their medical provider and with Medicaid to help get them additional formula if they're on one of those more specialized medical formulas. There are also some food banks in the area that are reporting they do still have formula available and are able to meet the needs of the families that are being referred to them. So I definitely encourage you to reach out to the food banks in your area and check in and see what their inventory looks like, what their referral process is.
Thank you. OCIM also provides formula.
Excellent. Any other questions or comments? Karen, you have your hand up.
Yes, hi, my name's Karen. I work for Welcome Baby in Durham County, which is an organization that serves families with children age 5 and under. And someone was asking what Durham was doing for the formula shortage. I mean, we're just a small organization that works with Durham County, but we do have a limited amount of resources in terms of formula that we are collecting. We're getting donations from different sources to buy formula. We also are having difficulty because they're putting a limit on how much we can buy. So we're getting creative to obtain the formula for families. So we do have a small bank of formula resources for the families in Durham. And also I received an interesting phone call last Friday. I had a worker call me who told me that they were at the post office and was talking to one of the postal workers and was saying that a lot of people are returning formula samples or formula that is being delivered to the wrong address. And they stated that they were not able to reship or send back the formula. So what they're doing is that they were throwing the formula away during a time of formula shortage. So I know my supervisors reached out, and she's waiting to hear back from the postal office to see if that's something that we can collect and then give out to families that are in need. But I'm not sure if any of you all have heard that before, so that's why I wanted to bring that up. But if you do have a family in Durham County, we do not have tons of formula, but we are being very careful with how we distribute what we are getting donated. So they can contact Welcome Baby and let us know. And if we have something available and can help them with at least 1 can of formula, you can feel free to reach out.
Thank you, Karen. I will say, I haven't spoken with any of our local hospital systems, but I would love to see hospital systems that are discharging fully formula fed infants, discharge them with a little bit more formula than what they typically do to help kind of bridge them until they're able to get some formula at home. I know typically they discharge with, 4 to 6 2-ounce nursettes, which is not going to get them through more than about 12 hours worth of feeding. So that would be an area that would be helpful. I think some medical offices have formula available and can possibly give a family an individual ready to feed container or a can of formula. It may not be the particular brand that they are looking for, but that's another possibility. But definitely reaching out to your WIC offices and the food banks. Another place, again, going back to social media, there are a lot of groups on social media who are sharing when they have things available. So, the Buy Nothing groups and the Joined at the Nip parenting groups, I've seen lots of posts when people have extra family available, and they'll post it and they'll help connect with families who are seeking formula. So that's something else. If you've got families that are social media savvy, maybe cluing them into connecting with some of those groups on Facebook and Instagram might be another way to help them. Anita, you have your hand up.
Thank you so much. Can you hear me?
Yes.
Okay. Thank you so much for doing this. This was fantastic. It's been very helpful. The question I had was about relactation. I was curious, what is the end, I guess the latest you could re-stimulate or be most successful with a patient who has had, who is, I guess, in essence, their milk has dried up, so to speak. Does that make sense?
Yes. Exactly. Natalie, you want to take that?
Well, I would actually wonder, I have not worked personally with many patients with doing relactation. I wonder if anybody in this chat has. It'd be great to hear any experience.
Charlotte, you were working with a family earlier today, right?
Yeah, I just had a conversation,
Amazing.
but this mom was only about 2 months postpartum and had probably within the last month stopped breastfeeding, and lo and behold, now there's a formula shortage and she's regretting her decision. So yeah, to answer your question, Anita, I feel like it is so individualized. A lot of it is hormone driven, and a lot of it probably also would be based on her milk capacity, her glandular tissue. So for example, if she was a mom that didn't produce much to begin with, she might not expect to relactate readily or produce that much, but perhaps if she, was an oversupplier, she might be able to relactate well to a full supply. I have heard stories. I have not worked with someone particularly, but I've heard stories of grandmothers relactating to help feed their grandchildren. So, that would be several years.
Yeah.
So yeah, the human body's amazing.
Thank you.
I do think the longer the amount of time since you've breastfed last or expressed milk last, probably the more of an uphill battle it is to get a decent supply back, but not impossible by any means. I know we have some other IBCLCs on here, and I don't know if you guys have more experience with induced lactation and relactation and can kind of speak a little bit more to that.
Can you hear me, Alicia?
Yes.
Thanks.
Hi, Angie.
I actually been fielding a lot of calls you know, I work out of Chatham now, but I live in Chatham. So I put it out there last week when all this kind of hit the fan. And I just reached out to the mom groups that I'm part of in Chatham County communities and let them know that I was available if they had questions or concerns. And I've actually had quite a bit reach out to me. And some of them are kind of like, oh, but like I had a mom recently that actually contacted me, and she nursed both of her babies for 2 years, but it's been 12 years since she nursed. But she really has a huge heart about relactating and helping the other mothers. And basically I started simple as possible. I mean, I just said, you know, we went through a little bit of history. We talked about concerns medically, and talked to her about, of course, the donor milk banks rules and regulations, which she wouldn't fit in that criteria. But we talked about informal milk sharing because she's part of some other mommy groups. And I said, the best thing to do is just start out, get you a good pump if you don't have one. If you want to start seeing what you see, doing those 8 to 12 pumpings in 24 hours. She's got free time. She's a work at home mom. Her kids are older. She said, well, heck, what's it going to hurt if I try? And I was like, that's right. What is it going to hurt to try? So she's trying. She's going to contact me over the next few days and let me know what she sees. And then we're going to go from there to see if we have any potential. And but I thought it was kind of like, you know, what's it going to hurt to kind of give her the information? And but I did tell her, I said, we don't want to get your hopes up because it may not happen, right? And she said, that's okay. It may not happen. But women like that, I mean, women, the grandmother story is awesome. But also, you know, I've had moms that had NICU babies and they started pumping and then they lost production, and I'm trying to help with them. And then I have moms that have been calling about different scenarios. So I always tell them, there's no silly questions, you know, ask as much as you want, you know. And going a little bit further, I've been approached to maybe have just an information day. So I'm trying to take in everybody's information, y'all's information, United States Breastfeeding Coalition information, NCBC's information, North Carolina, any kind of thing that's going on in North Carolina wide. I've been trying to pull those resources together. And I've been contacted by some moms that are wanting some more information locally in South Chatham is what we call it, in the rural parts of Chatham. And so helping them to kind of just affiliate, you know, to be a facilitator, sorry, long day, to get them to kind of just have an open roundtable discussion, just to get talking about the concerns that we're having. And so I'm going to probably reach out and do that on a Friday and Saturday when I'm home. So I'm going to try to push that out on social media and do a live and maybe just talk. And some of these things are just going to be totally free. Of course, they're free. I'm a private practice lactation consultant on the side, but this is my heart and I want to help my moms in my community. So that's just a few things I'm doing, just simple, basic things. And I'm just trying mainly to get the conversation started so that some of the anxiety, because there's a lot of anxiety right now with moms not getting the best information and wanting to do things they shouldn't do, and things people telling them things that they did back when they had their grandbabies, you know, like, let's pet milk. We did syrup and K-Rose syrup and water. And I'm like, oh no. So there's been a lot of those things that have come my way, but it's a really concerning time right now. But I think if we pull together, and I really appreciate being able to jump on a little late and get with y'all, but gosh, we're doing such a great job. I mean, I say kudos for everybody that I've been listening to. Kudos for everybody outside of our community in Chatham and Durham, and those that have been working really hard in a very short amount of time. So thank you all for what you do, because we all are a little bit working together in all aspects to help our communities. So thank you so much. And thank you, Alicia.
Thank you, Angie. And I will volunteer the PHS breastfeeding team for your grassroots efforts in South Chatham. If you need some extra help, just let us know. Any other questions, comments?
Alicia.
Yes, Bernadette.
When are we going to actually get all this information out to everyone?
Well, that's a good question. I plan to send out all the resources that we have, the slides of everything that we've put together today and the recording, to everyone that's on this call and to all of the listservs that we have access to. And then from there, everyone is welcome to freely share. So if there are things you'd like to post on Facebook, there's some parent fact sheets and some other information, please feel free to do that. we can only reach as far as our networks can reach. So please feel free to spread the word. And then, we are all here to be resources as well. So if people have questions that weren't covered in the materials and the resources, please let them know that they are welcome to reach out to any of us at any time. And even if we don't personally have the answer, we're happy to help try to connect them with somebody that does. All right. I was just going to say, if you did not, if you did not get this invitation directly from Breastfeeding Family Friendly Communities or from me at Piedmont, if you want to drop your email in the chat, just so we can make sure that the stuff gets back out to you. I don't want to leave you out. And then Anne, what was it you were going to say?
I just want to say that I think it's a time to be impeccably honest about relactation. I mean, I love, having people relactate and helping them, but at this time, I mean, they're usually people who have a house full of formula or, access to other milk. Right now, we're dealing with a family who may have nothing else. And I'm going to be really honest, if you haven't breastfed in 6 months, yeah, we can try relactating, but it's not going to be what you're going to depend on to feed your baby tonight or tomorrow morning. So we have to be honest about that. Yeah, grandmothers can produce milk. Sure, they can, but this is a lot different than it's ever been before.
Right. It's not an immediate solution by any means. It can be part of the solution, but it can't be the only solution.
And I was just interviewed by WRAL a little while ago, which is kind of crazy with all this information. But I mean, milk sharing is life-saving. It's not perfect, but it's gone on, for a million years. And I mean, with wet nurses, which we don't have. And if it's life-saving and there's some risk involved, again, these are really, really different times than we've ever experienced, as is usual in our world for the last 2 years. So, yeah.
I agree. I will say too, that in spreading the word about informal milk sharing, there's probably a lot of folks out there who have an abundant milk supply who maybe haven't considered milk sharing before, but knowing what's going on with the formula situation, would be interested in increasing supply or sharing some of what they do produce, and helping get them connected to those milk sharing resources would be really, really helpful too. I know donating to the milk bank, there's a lot of very strict criteria involved. And unless you're kind of planning ahead for that, that can be a little tricky for a lot of folks. And again, it's not an immediate availability for those that are in need. So thinking about safe milk sharing is a great option. Love, you have your hand up.
Yes, the question about how will we be getting all of the resources out? We will be posting all of the content on Breastfeeding Family Friendly Communities website, breastfeedingcommunities.org, as well as we just posted a link today during this meeting linking to the updated Carolina Global Breastfeeding Institute resources. They just published a page during this meeting, as well as I encourage you also to check out Moms Rising. They have, as of today, have put together a newsletter that you can subscribe to get ongoing updates.
And I think the NCBC has some information. They just sent a newsletter out today too. Anything else in the chat that we haven't addressed, or any other comments or questions?
So Alicia, I have something. Right now, we have to do more homework and at least try to connect with everybody in each county and for them to share the information that we just received today.
Yeah, I agree. And if you have the contacts of particular groups or people that you would like to make sure that we reach out to, you're welcome to share those contact information too. And I'd be happy to politely reach out and share some resources.
Okay, so I will, I don't know every last one of them by by the spelling right now by heart, but I will email you that
Okay.
tonight.
I'd be happy to work on that tomorrow.
All right, thank you.
Can folks please invite Equity Before Birth to more conversations and updates? Because we have a lot of families asking. I just want to get the correct information. And in particular, I think it was Welcome Baby that said they started. Yeah, thank you, Karen, to coordinate efforts. But could we have a conversation with y'all to join in on the coordinated effort? Because our demand got so high, we had to create a response. But I would encourage us to join forces instead of there being like 10 separate responses.
Yes, I love that. I will be. Did you put your email in the chat, Joy?
I did not, because I get 100 emails a day and I won't see it. But I would love to take y'all's email and I can and phone numbers and make sure we get connected.
I'll put mine in the chat now. I totally understand about the inundated with an overwhelming amount of emails. I don't check my personal email ever, but my work one is the way to get to me. I don't know if that's sad or, but that's the truth. All right, just put my email in there. Any of the other speakers that are still on, if you all would like to drop your emails in as well. All right, well, it is almost 7 o'clock. So I'll let you all go. Thank you so much for spending your dinner hour with us. And I will be, like I said, sending out the resources, the slides, and the recording, and would love, love, love to connect with any and all of you to partner together to reach more folks and to get more support out to our families in our area. So thank you all so, so much for spending this hour with us. And my heart is warm by how much people are trying to, reach in and help the community, and you all are amazing. So thank you. All right, I will leave the chat open for one more minute in case anybody else wants to drop their emails in there, but I will stop recording.